There's all kinds of places you could work for a vendor, a software company. You know, you can work for a consulting company. You know, it's pretty much, you know, the sky's the limit. It's a fairly new profession, so a lot of us are out there just sort of making our way. When I originally came to the VA, I was hired as the BCMA coordinator, which is barcode medication administration, which the VA is pretty far ahead of the curve on that. And that was 5 years ago. And since that time, I've evolved a whole department of informatics, and we have a whole direction now of having clinical folks in informatics that are supporting all the software, the clinical software. And I think the sky's the limit with nursing informatics because, like I said, it's a fairly new profession.
Why?
And it's because healthcare traditionally has lagged behind as far as implementing electronic records and those kind of things. We're pretty far behind the business sector, you know, all of those places. So now with the big push, you know, for all the hospitals and, you know, basically all of healthcare to be electronic, you know, now we see this growing need for the clinical folks who have this knowledge. And, you know, the other thing is that to me, nurses spend so much more time with the patient than any other profession, especially in a medical center. If you think about how much time the nurses interface with patients, and then how much they interface with the patient's chart, they have such a huge chunk of it that, you know, their involvement in this is critical. We don't want other clinical professionals telling us how we need to document care, you know, and where we fit in the process. So, you know, that's to me where, you know, you can pretty much go where you want to go and do what you need to do, and we have just a lot to bring to the table.